I was trying to impress a girl in high school and told her, oh, I think I want to go to med school. And she goes, oh, my dad's a doctor. So then he was gracious enough to allow me to shadow with him when I was in high school. And that kind of lit my fire. And once I saw that, then I had a job as an orderly in surgery the summers of college. And those kind of things really just kept motivating me to keep grinding on the studies that are required and the intensity that's required to go and graduate from medical school. And then obviously surgery has always been a passion of mine, of fixing things and helping patients through that. And that's why ultimately surgery was decided. You know, our national society has started a little bit of a branding campaign to refer to vascular surgeons as the firemen of the hospital or the fire people, because we're the ones that get called when something may be going wrong in the operating room, because a lot of times that involves vessels and bleeding and whatnot, and they call us in to help out in those scenarios. We obviously get involved in some trauma, and there's other acute emergencies and vascular issues that can come into the emergency room. Ruptured aneurysms, ischemic or extremities that have a lack of blood flow. There's some acute stroke scenarios that we get involved in to help treat. So we have a pretty robust role in the inpatient world. And then the outpatient world is very robust as well, because a lot of vascular disease, we don't cure it, we manage it. And once you develop some vascular disease, very important to follow that long term to ensure that you can reduce your risk of developing a symptom or a complication from that down the road, and that's where we can really assist. I think a big thing for me when I first see a patient is I really do want to establish that trust and educate and really inform that patient, okay, this is why it looks like you're here to see me. These are the short-term things to look for, the long-term things to look for, and how are we going to attack this together? And again, I think it's really that education of the patient on what they have going on, establish that trust, and then talk about options. And then those decisions are shared decisions. It's not, going to the doctor and the doctor says, you need to do this. There might be a little bit of that with lifestyle changes and whatnot appropriately, but I think establishing that trust, the relationship, and then the education, because the more the patient knows about their condition, the better they're going to be at helping manage that long term. I always love it when I come to office and I see patients that I've seen for a long time. How are your family doing? They know my family. So it creates a nice environment and a welcoming environment, but most importantly, it establishes that trust. So then when you do have to make some difficult decisions about maybe doing surgery to correct a disorder, everybody's on the same page and everybody trusts each other. I think the Cleveland Clinic has the best reputation in medicine in the country, if not the world. And that's a big reason I joined the Cleveland Clinic. And a big factor there is there's significant research involved. There's significant subspecialization and expertise across Florida and Cleveland, and we have connectivity to both of those. And if you look at, say, the Society of Vascular Surgery, our national society, a lot of Cleveland Clinic influence is involved in setting those guidelines and appropriateness of care that the rest of the Vascular Surgery Society is supposed to follow.